Welcome to Conversations Live. For more than a decade, we've brought you the best in books, entertainment, celebrity interviews, and current events. When the movers and shakers of the world have something to say to you, they say it to us first. Now celebrating 17 years of broadcasting success, here's your host, Cyrus Webb.
And welcome back, everyone, to Conversations Live. I'm your host, Cyrus Webb. Glad you all could join us once again, both for our radio audience here in Mississippi at WYAD 94.1 FM and WYADonline.com. We're glad that you all could be with us. Also, just tuning in to our friends at iHeartRadio and Amazon Music Podcast. We're glad you all could be with us as well. This is part of our News You Can Use segment, and one of the things we want you guys to know is that the Medicare annual enrollment period is almost here, and with more than 10,000 Americans turning 65 every day, the need for clear information on Medicare is more important than ever. Because of this, we're excited to welcome back Rick Dunlop to our program. Rick is the Health Plan CEO at United Healthcare Medicare and Retirement. He's going to let you guys know what you should be thinking about when it comes to this year's open enrollment, as well as where you can get more information. Rick, thank you so much for the time. Really appreciate it.
Hey, thank you much, Cyrus. It's a great time to be here.
Well, as I mentioned, Rick, a lot of people are starting to hear about the annual enrollment for Medicare. When exactly does it start, and why is it so important that our audiences are aware of it?
Well, timing is everything, and so if you're actually in the neighborhood of 65 years old, you have the 3 months before you're turning 65, the month you're turning 65, and the 3 months afterwards to enroll in Medicare. Now, if you're already enrolled, as you stated, annual enrollment is right around the corner. It starts October 15th and extends through December the 7th. If you're an individual who's experienced a significant life change, you might call the Social Security Administration because you could be eligible for a special enrollment period.
So, Rick, when it comes to people considering this, what should they keep in mind when enrolling in a Medicare plan?
What I find is, and it's true all around, and it's amazing, is one size does not fit all, and so it can be kind of complex. So we want folks to kind of do their homework, consult with an advisor if they can, talk to family members. But what I always do is say, keep it simple. Start with a list of the providers, the physicians, the hospitals that you're interested in, that you favor. Spend some time making a comprehensive list of the medications that you're currently taking, just to make sure that nothing is overlooked. And spend some time thinking about, how your benefit plans are taking care of you, during this year, during and what you're really looking for in the coming year, because there's a lot of tremendous options that are going to be available. And last but not least, we absolutely can't overlook the budget, because the budget's really crucial. And so what you want to do is look at your annual notice of change that you might have received in the last couple of weeks, look at your checkbook, and just make sure that the benefits that you have available today, work for you all around. And even if you feel like they do, check the market, do some shopping, because there's a lot of great things that are going to be available next year.
Well, that brings up an interesting point then, Rick. When it comes to the discussion of Medicare, can you discuss the different types of Medicare and what is the difference between original Medicare and maybe something like Medicare Advantage that we may see the commercials for?
Okay, yeah, so that's a great question. And so original Medicare is, sponsored by the federal government, and it includes Parts A and B, which cover most expenses around, inpatient services or professional fees. That would be Part B, for your doctors and outpatient hospital or home health. But it doesn't cover everything. And so a lot of folks will end up buying a Medicare supplement, and they'll pay a premium for that on a monthly basis, and it'll cover the things that original Medicare doesn't. What people are starting to favor in increasing numbers, Cyrus, is the Medicare Advantage plans, because those Advantage plans, provide very low co-pays, low predictable co-pays. So it's very affordable, but it also adds in a lot of added benefits like dental, vision, and hearing, sometimes transportation. But one of the things that's probably most popular is that gym membership at no cost. And so people are really looking at it as a way to work on their financial budget as well as their health and keep them healthy and independent.
I think that's the great thing, and that's why we're glad, Rick, that you can be back with us. Again, everyone, Rick Dunlop is our guest, Health Plan CEO at United Healthcare Medicare and Retirement, sharing with you guys about this year's Medicare's open enrollment, what you should be aware of, especially if you are turning 65 soon, or if you already have a plan, to be able to, of course, to make sure that you have the plan that is best for you. Rick, where can our audience go for more information?
Well, what I do is this time of year, there's lots of community events that are available, some in person, some online, but I also recommend that people go to gettoknowmedicare.com, because there's a lot of that written content as well as webinars that people can get themselves educated and ready for annual enrollment right ahead.
All right, gettoknowmedicare.com, and we'll make sure that we link that up for our online audience. Rick, you're always great for us for our news you can use. Appreciate the time, and looking forward to having you back again. Thank
you much, Cyrus. Have a great day.
You as well. And we thank your audience for tuning in to another great segment of Conversations Live. Until next time, I'm your host, Cyrus Webb, saying as always, enjoy your day, enjoy your life, enjoy your world. Thank you all for choosing Conversations Live. Now let's go make today amazing. Take care.